Here's the painful truth about doing all-on-4 on just one arch. You're essentially marrying perfect teeth to imperfect teeth, and when you inevitably want to fix the other arch later, your perfect prosthesis becomes completely useless and has to be thrown away. Today, our prosthodontists at North Texas Dental Surgery are revealing why single arch all-on-4 is one of the most difficult procedures to execute successfully. You'll discover why matching straight upper teeth to crooked lower teeth creates dangerous bite problems, how financial decisions to do one arch now, one later, actually cost more in the long run, and why patients with single arch treatment are often the unhappiest with their results. And stay tuned, because we're explaining the marriage concept that most patients don't understand, why your upper prosthesis is designed specifically for your current lower teeth, and how this limitation makes it nearly impossible to deliver good aesthetics, function, and speech when you only have one arch to work with. This could save you from making a costly mistake that seems financially smart but creates long-term problems. I want to shift gears right now, and we just literally had a patient that we saw 2 hours ago for a consultation who had his all-on-4 done 3 weeks ago, as he said. He just had his upper arch done, and I want to get your guys' opinions because we thought ideally in a case like this that he would be best served if he did both arches, but financially or for whatever decision, sometimes, actually most of the times, a lot of patients decide they only want to do one arch. And if we're going to talk about one arch, they typically decide to do the upper arch because of aesthetic concerns also. So could you guys tell me, from my perspective, surgically, I could do one arch or two arches, it's not a problem, but that severely can compromise you guys. Could you guys elaborate in regards to why doing a single arch is often more challenging than doing two arches?
I think single arch is definitely one of the most difficult procedures to execute perfectly. The reason is because we're making it imperfect, where we're matching the imperfections of the bottom teeth to begin with, right? So if your bottom teeth are misaligned, if they have one side higher than the other, we can give you perfectly straight teeth on top then, because the top jaw has to be in unison with the bottom jaw when you bite. So if, let's say, if we give you very straight teeth on the top and your bottom teeth are like this, without touching the bottom teeth, the only side that will touch is one when you bite down, which will, again, is basically malocclusion, because your bite is going to be only stressing on one point, and that could fracture or damage those implants or the prosthetic. Secondly, I think when we are doing an upper and lower jaw surgery, we're planning or discussing the position of the future implants with the surgeon, upper and lower together, because we're keeping in mind that the upper teeth are hypothetically going to be at this point and the lower teeth are going to be at this point. So we actually take into account the position of the teeth and then place the implants appropriately. If we're just doing one arch, we're actually finalizing everything against an imperfect lower, and that's essentially a marriage almost we're doing of sorts, that we're marrying the upper teeth now to the imperfect lower teeth. So if the patient does decide after 3-4 years that, you know what, I want the bottom teeth to be done now, then we run out of options in terms of the upper prosthesis, because many times we have to end up changing the upper prosthesis now. So they've completed one treatment, we have to restart the treatment in terms of at least the prosthesis being renewed on top. I think that's the number one thing that a lot of patients don't understand about, that when you marry the top teeth with new prosthetic with the bottom teeth, it's essentially that prosthesis is going to be useless once you change the bottom teeth, unless you actually make the lower prosthesis exactly like your old teeth, which you probably wouldn't want because your teeth had to be taken out for a reason. If there was nothing wrong with them, then you wouldn't really take them out, right?
Yeah, I think when we do just like one arch, either upper and lower, the main thing is that the other arch it's a limitation. It's telling us where the teeth have to go. So we don't have like the freedom to position the teeth where we want. We have some freedom, but there's also like limited by the lower or the upper teeth, depending which arch we're not restoring. And most of the times, patient that hasn't needs an all-on-4 in one arch, the other arch, it's not in a really good condition, because normally patients don't just like get terminal dentition on one arch. Normally it's like both upper and lower, and it's a financial reason which patients want to delay it or not doing it. So we're actually like trying to match our prosthesis to patients' existing teeth that are normally like not in the right position or supererupted, which means like they're like out of the wrong position. Even they can have like decay or periodontal disease. So yeah, that's the most complex part.
So I think the question you asked, which patients are the happiest with All-on-X? I think if you ask me which patients are the unhappiest with All-on-X, would be the ones with a malocclusion on the lower arch and then just one prosthesis on the upper, because it's incredibly hard to deliver on their expectations of good aesthetics, function, and speech, especially when we only have one arch to play with.